Good evening. This is Dr. David Tam, President and CEO of Beebe Healthcare, and today is Thursday, February the 4th, 2021. It is now 5 o'clock in the evening, and we are here to do a very special video town hall for the population and the people here in Sussex County to talk more about COVID vaccine, and other things related to healthcare here in Sussex County. It's a little bit special because today it's not just Dr. Chasanov and myself. We really want to focus on extending our hand to the people of color here in Sussex County. You know, it is a well-known fact in the national media, as well as studies done, that there are many people who are culturally concerned about, getting the vaccine. Even my mother was a little bit concerned about getting the vaccine as an Asian American, not really sure what that would do, what the medications, what the impact of taking certain medications, with getting the vaccine, what the side effects of the vaccine, and, what are the potential complications or issues. Is the vaccine safe? And, I actually had to speak to her in her native language, Japanese, to go over some of these things and talk about it with her. And then, of course, she felt comfortable. She has taken her first dose of the vaccine out in California and feels really good about the fact that pretty soon after her second dose, she'll be able to spend time with the family, with the grandchildren, and those are all really important things for her. So tonight, you're going to hear a couple things. You're going to hear from Dr. Bill Chazenov, who is our COVID-19 medical director. He'll introduce himself, but he is someone who was born and raised right here in Milford and Sussex County, and then has come back to practice with community. So really, really familiar with the people here of Sussex County. And then you'll also hear from Dr. Arias, our ICU medical director. And then, of course, I want to introduce you to Dr. Roseanne Gichuru, who is just joining us from Pennsylvania. She is she's an African-American descent, comes from a very unique background, and she'll also share with you a little bit about her history, maybe a little bit about her mother, and also at the end of the day, all of us are going to talk about the vaccine and COVID and how we just need to take care of ourselves as we move forward. Now, this is going to be recorded because at the end of the day, many people are still working. There are people who are working hard, whether it be in industry or at the offices, or in other services here at the hospital. So we are recording this, and we will continue to make sure that it gets out on social media as well as other channels so that you can see it. But right now, we are recording. It is February the 4th, Thursday, and it is 5 o'clock in the afternoon. So please know that information changes very quickly with COVID-19 and the vaccine, and we will continue to get you that information. But for now, I'd like to turn it over to my colleague, Dr. Bill Chazenov, who will talk to you a little bit about the COVID-19 vaccine. Dr. Chazenov.
Thank you, Dr. Tam. I appreciate that. I want to thank all of you for your time this late afternoon and evening, and it is my pleasure to spend the next few minutes with you and my colleagues to try to update you on the best that we can about COVID-19, the state of Delaware, our community, and Beebe Healthcare. I echo what Dr. Tam says. I'm so excited to have Dr. Arias and Dr. Gichuru here with us tonight. I think that it's fantastic to hear from someone besides Dr. Tam and I to talk about the vaccine. So I am most appreciative of their time. As Dr. Tam was saying, my name is Bill Chazenov. I am an infectious disease physician here at Beebe Healthcare. I've been here for about 3.5 years. I've been operating as the COVID-19 medical director for the past year. And as he was saying, I am a Delaware native. I was born in Sussex County and raised in Sussex County, on the Sussex County side of Milford, as a matter of fact. And as I had mentioned before, Dr. Arias is joining us tonight. She is a pulmonologist, which is a lung doctor, and the medical director of the intensive care unit here at Beebe Healthcare. and Dr. Gichuru, who is an obstetrics and gynecologist here at Beebe Healthcare. I want to start by telling us where we are as far as COVID-19 goes and where things have trended over the past few weeks. As most of you know, we had a surge that occurred in April, at the end of April, and in May in this area of 2020. We had many people hospitalized. We unfortunately had many cases at that time. Over the late summer and the early fall, we noticed a decline in cases throughout the state of Delaware and also throughout the United States, with some exceptions. Unfortunately, as expected, around the holidays and post-holidays, we saw that surge come back again, or a second surge that occurred in our area. This surge, which appears to be improving at this point, was actually, from a hospital perspective, we had more people in the hospital throughout the state of Delaware during this surge that is hopefully ending than we did back in April and May of 2020. So now I'm going to talk a little bit about numbers, so bear with me for a minute. So in the United States, it appears that we are seeing less active cases that are appearing every day. Over the past 7 days, on average, we have been having about 140,000 new cases. And again, that's in the entire United States. That's much better than sometimes topping over 200,000 new cases on certain days over the past couple months. Unfortunately, there has been over 446,000 deaths in the United States that have been contributed to COVID-19. And that's since the start of the pandemic, which has been going on now for a little over a year. In Delaware and in Sussex County, the number of new cases on a daily basis also appears to be decreasing, which is good news. We have unfortunately lost greater than 1,100 Delawareans due to COVID since the start of the pandemic, though. In Sussex County specifically, the average number of new active cases are decreasing. And with that, we are also seeing a decrease in the number of hospitalizations throughout the state. About a month ago, we were well over 400 hospitalizations on a daily basis. And there are times where we were almost close to 500 hospitalizations on a daily basis throughout the entire state of Delaware. We are now lingering about 300 to 350 people hospitalized on a daily basis throughout all the hospitals in the state of Delaware. What's also interesting is that back in our first surge, which occurred in April and May, Sussex County was hit pretty hard. Not that Newcastle and not that Kent County were not hit hard, but Sussex County seemed to be hit harder than the other counties. The second surge, Sussex County continued to have a lot of new cases and was hit, but it appeared that Newcastle and Kent County were interestingly hit harder than Sussex County. I do not want you to think that Sussex County was spared, though. It's important to realize that. I'm going to spend just a couple more minutes before I pass this off to one of my colleagues to just talk a little bit about the vaccines and the vaccine process. So I want you to hang in here with me just for a couple more minutes. So currently, there are 2 vaccines that have received the United States Food and Drug Administration's emergency use authorization. These are the one is the Pfizer vaccine and the other is the Moderna vaccine. Both of these vaccines use the same type of science in order to help our bodies, after we receive the vaccinations, to produce a response in our immune system that will help us fight off the COVID-19 virus. I think it's extremely important for everyone to know that neither of these vaccines contain any live virus. So what I mean by that is that the virus that causes COVID-19 is not being injected into you with these 2 vaccines, these vaccines from Pfizer or Moderna. They do not contain any live virus, and someone can actually not develop the COVID-19 disease or infection after receiving the vaccine from the vaccine. And let me just clear that up for a second. After receiving a vaccine, it is still possible to become infected with COVID-19, but it is not possible to get the COVID-19 infection from the vaccine itself. And I think that's really important for people to understand. So While these two vaccines are out on the market, there are new vaccines that are in the pipeline, meaning that are in development that we should have on the market, hopefully within the next few weeks to several months. The one that is most likely going to be approved in the United States first is a vaccine from a company that most of us have heard of, known as Johnson and Johnson, and then another vaccine that is from a company that some of us may have heard of from AstraZeneca. So once those two vaccines are on the market and approved, that will increase the amount of vaccine that we have in the country and also in the state of Delaware. With that being said, I'm going to give you a break from me for a few minutes, and it is my pleasure to introduce my colleague, Dr. Arias, who is a lung doctor. She is an intensive care physician. She is also a sleep physician, and she is our medical director of the intensive care unit here at Beebe Healthcare. Dr. Arias?
Thank you, Dr. Chasanov. Like they say, my name is Ercilia Arias. I'm a pulmonary and critical care physician. I'm Hispanic, so Spanish is my primary language, although I have been living in this country for about 30 years. And I also have a unique perspective about COVID-19 disease. Due to my ICU training and due to what we have been dealing, all of us together this past year. We have been able to see the worst of COVID-19. We have taken care of a few hundreds of patients with this disease, and we have seen what not only does to the body of the patients that are not here with us anymore, but also the patients that are being able to locally survive from this disease, and what is happening to the families, the community, plus, like we all know, there's a lot of questions that still remain to be answered. And in that case, just time is going to be the key element. Since regarding the vaccine, just like Dr. Chasanov said, I had to do my own research because just like anybody, we all have questions, we all have doubts and misinformation and misconceptions. One thing is clear is that if we get infected by the SARS-CoV-2 virus, we create an immune response. We just don't know how long that's going to protect us, how good. And we then have to have a plan B to be able to fight this pandemic, and that is through vaccination. I think we have understand, hopefully as a society and as a country, that herd immunity, or just waiting for the 65 or 70% of the people to get sick to be able to have a safe haven, is just not possible, because a lot of people then we will lose a lot of people if we go that route. Just like Dr. Chasanov said, the COVID-19, the two vaccines that we have available, it is a fantastic technology. It is, after I did my research and read more about it, it is a technology, like you probably have heard, has been around for years. For over 30 years, there have been people working on this technology for different purposes, but this is when we need it now. And like Dr. Chasanov said, there's no virus in this vaccine. This vaccine just carries a message, and it's going to tell some part of our cells to recognize the COVID as the enemy. Therefore, we're going to build up an immune response. We're going to get our immune system up and going. We get a good, I think it's about 52% with the first dose, and it takes for the second dose up to 95% of the two vaccines that are currently approved for use. So it's like I said, after I did all this research, I understood why did I need to get vaccinated? What is so important, not only for me, for my colleagues, but for the Hispanic community to get vaccinated? And I can speak about that because I had the opportunity to take care of a large number of Spanish-speaking patients in the ICU. Because we have also read about other states also that had a high Hispanic population and how they've been affected and how it's actually affecting a young population. It's affecting men and women between 20, 30, 40, 50 years old, and is in some states such as California, it's decimating a generation. So it is really very important for us to understand what this vaccine is doing to the entire country, but what it's also doing to the Hispanic community. We are a high risk population because a lot of Hispanic people work in the service area because we also don't have a lot of access to health care. So there's a lot of barriers, and there's a language barrier, but there is a mentality barrier, there is a cultural barrier, and there's a lot of myths that I also grew up with, and it takes time to eliminate these misconceptions. So there is information. We have talked in the past to reach out to your community leaders, to reach out to your physicians, to reach out to the information that Beebe as a healthcare system has put out that help us to eliminate all this misinformation. So it's really very, very important for us to get vaccinated. Hopefully, if we get that 60%, according to some experts, others talk about 70% of people to be vaccinated to reach that herd immunity. I think it's, thank you very much. And I think it's time for me to pass it on to my colleague, Dr. Gichuru.
Hi, everyone. My name is Dr. Gichuru. It's a pleasure to be here. A little bit about me. I'm originally from Kenya, and then I moved to New York City, moved to Pennsylvania, and now I am in Delaware. I am a board-certified OBGYN. I recently joined the community and the hospital as a medical director of the Women's Health Line, and I'm looking forward to becoming and contributing to this community. Several of my core values, family, service, and community. And for me, the main reason why I got the vaccine was because of that, being able to protect myself, being able to protect my patients, and being able to protect doing my role or playing my part in protecting the community as a whole. Now, as an OBGYN, I take care of more than one patient, so it's not just the mother of the pregnant woman. I am also taking care of the growing baby. So it was especially important for me to get the virus to be able to protect not only myself, but my family, my patients, and the community at large. Now, the second reason, and this is more of a personal reason, is I actually had several family members who lost their lives to COVID. It was very sudden, and it took a toll on my family unit, but seeing the significant losses to the family is another reason I opted to get the vaccine. Now, this is a novel virus, and when it came out, there was a lot of information, there was a lot of questions, and I'm the kind of individual who, if I don't understand something, I'm going to make a point of investigating it. So I actually took the time to attend both the CDC and the FDA vaccine information sessions. I also sought out credible webinars hosted by the individuals who, one, participated in the drug trial or the vaccine trials themselves, but also was able to attend a webinar in which Dr. Kizmekia, who is the PhD who had been working on the Moderna vaccine. So to be able to get that information firsthand was really good, but also importantly to be able to sit in and listen to the questions that were being asked, to learn more about the virus, the side effects, and how it was actually going to be rolled out, how they were going to monitor for the side effects, and being able to tabulate that, for me was very important. Once I collected that information, I actually subsequently sat down and did a side-by-side. So the first two viruses, the Pfizer and the Moderna, I actually sat down with a sheet of paper and compared both vaccines side by side. So I did my due diligence in part one to be able to get some answers to some very important questions, to learn more about the disease itself, but also what I could do to protect myself, my family, and the community at large. And then lastly, also being able to serve my patients by giving them information, especially my pregnant patients. What does receiving the vaccine mean to them and to their pregnancy? Our national body, ACOG, does recommend that pregnant women, especially who are at high risk, do receive the vaccine. So to be able to share that information with the patients was especially important for me. Now, having received the first dose of the vaccine and will be receiving subsequently the second dose, it has been good to walk in those shoes, to be able to say, yes, I received the vaccine. These are my side effects. This is what I did to manage the side effects, given what I had learned in the different venues that I acquired the information. Now, I also recently became an aunt, so yay. And I love to travel. So I'm hoping that by getting the vaccine and by more people getting the vaccine, we'll be able to slow and hopefully eliminate the COVID pandemic altogether, and be able to resume regular activity with regards to family gatherings, being able to travel. I also have a 92-year-old grandmother that I was unfortunately not able to see last year, and I'm hoping that with the vaccine becoming more and more available, both locally, nationally, and internationally, that we will be able to reunite here shortly. So I encourage everyone around me to please do your due diligence, seek out the information, ask the questions, follow up, investigate further, do what's in your best interest, which is basically giving yourself an additional layer or an additional tool to protect yourself and your loved ones. And of course, observing the social distancing mandates and wearing the masks. We're all in this together, and together we will get through it. Thank you.
That messaging is amazing. So thank you, Dr. Arias and Dr. Gichuru. It's just powerful to hear those type of things, and I really appreciate both of you taking the time to talk to everyone, in all the communities of Sussex County about your experiences. Congratulations on being an aunt, Dr. Gichuru. But really sharing some of the personal things as well, and how COVID has affected you and your families. You know, one of the questions that I get asked very frequently is, is this vaccine safe? And I know that Dr. Gichuru, you started to talk about that, and I want to elaborate just for a couple minutes on that, in case that there are additional questions. So one of the things that I think are important is that right now on the market, we do have 2 vaccines that are under emergency use authorization from the Food and Drug Administration. The first one that came out was the Pfizer vaccine, which was approved on December 11th. And then within a week or two after that, the Moderna, with an M, Moderna vaccine, was approved. With that being said, as Dr. Arias had mentioned in her discussion, that these both use a special type of technology that has not necessarily been used in vaccines before, but has been used in other parts of science and medicine and technology. And that involves something called messenger RNA. I'm not going to bore all of you with this, but it's actually quite fascinating technology. What's interesting about these vaccines is that the efficacy rate of these vaccines are in the mid-90s, so 94 to 96+%, no matter if it's the Pfizer or the Moderna. So there really is not much difference between an efficacy rate between the Pfizer and the Moderna. They both are in the mid-90s, so that's pretty impressive. It's also important to know that the only two vaccines that are available for COVID-19 right now are messenger RNA vaccines, one being the Pfizer, and then the other one being the Moderna. So the other vaccines that will hopefully make it to us, the public, the market, within the next few weeks to few months will not necessarily be using messenger RNA, but the only vaccines that are available right now are using that technology. With that being said, that goes back to safety. Most people want to know, how do we have a vaccine really within a year's time of finding this infection or finding this virus, this COVID-19 virus that is, and it's truly the COVID-19 disease that's caused by the SARS-CoV-2 virus that Dr. Arias had talked about. So if you hear COVID-19 and SARS-CoV-2, for most parts, they're interchangeable. So they're talking about the same infection. Well, what happened is that amazingly, back when this virus was being discovered, this virus, the genomic map, the genetics, what makes this virus a virus, that was all mapped out by scientists throughout the world. And in January of 2020, that was put out to the entire scientific community. So that way vaccines and testing could start to be worked on. So what's important to know is that initially we didn't have any tests that could test for this type of virus. And if you guys remember that it wasn't until several weeks to several months after the virus was identified before we had reliable testing that we could determine that this was the COVID-19 virus that was causing someone's infection or their illness. Well, now we've had that, and we've had that for months and continue to improve upon those and provide more testing opportunities. During that entire time, the vaccine was already starting to be worked on. And what I mean by that is that scientists from different pharmaceutical companies, governments through different countries, started to put significant amount of resources onto developing a vaccine, because we knew that there was a good chance that the only way that we would be able to get out of this pandemic by saving as many lives as possible and saving as many people from getting ill as possible is to develop a effective, safe vaccine as fast as we possibly could. It's important to realize that there is an entire process for any vaccine or any drug or any treatment in the United States to receive an authorization or an approval. Both the Pfizer and the Moderna vaccine went through all of these phases and went to different organizations to have their safety and effectiveness reviewed before the Food and Drug Administration authorized them for usage starting on December 11th. In the trials, where people sign up to receive the vaccine and then agree to be monitored for any side effects or problems after receiving a vaccine or any medication, between the Pfizer and the Moderna vaccine, there was over 70,000 people enrolled in that trial from multiple countries. So it's important to know that it was just not the United States. There were countries such as South Africa that were included, the United Kingdom. There were countries from all over the world that were included in these clinical trials. People from different ethnicities and races and ages, men and women. So there was people that were represented throughout. And again, there was over 70,000 people in those trials before it even went to the Food and Drug Administration for potential review. Since these vaccines have been authorized, we now have given, and not we as in Beebe, but we as in the world, have given over 100,000, over hundreds of thousands of doses of these vaccines. And we constantly are reporting any side effects that may occur, so that way we can continue to collect data. So I want everyone to know that just because this vaccine or these vaccines have been authorized, it doesn't mean we stop and we don't look to see what's happening afterwards. That's all continuing to happen. And I hope that that gives you some ease, as it's given me, and it's given Dr. Arias, and it's given Dr. Gichuru, who all have done their own. I will tell you, they've all done their own research. Even though they've asked me questions about it, they have all done their own research and asked their own, their own colleagues and others as well about what they think of these vaccines. And I expect everyone to make sure that they are talking to their providers and making sure that the vaccine questions that they have are being answered. Another question that I get asked is, how can I receive the COVID vaccine? And that's a really important question. So the state of Delaware is currently operating in what they call a phased system. The top tier of this phase is 1A, as in apple, and we are now operating beyond 1A into another phase that is known as 1B, B as in boy. The focus for the state of Delaware right now with 1A are healthcare workers and long-term care residents, and those are both included in 1A. In 1B, that includes those who are 65 or older, not depending on what medical conditions they have. It is strictly from age 65 or older, and that is where the state of Delaware is focused. Now, it's important to realize that in 1B, so 1B as in boy, there are other groups that do fit into that category. And those groups include, but are not limited to, educators, production workers, line workers. We also have what are called essential frontline workers, so grocery store and others. So it's important to realize that even though the state of Delaware is focused on the 1B 65 or older, over the next few weeks, others in that 1B category will start to open up. I think it's important to realize some numbers here too. So let me just talk about how we are in the state of Delaware from a population standpoint. So in the state of Delaware, we're roughly just less than 1 million residents. So 1 million people live in Delaware. With the opening up of 1B, so you have 1A that's already opened and now 1B, we have basically opened up the eligibility of about 200,000 Delawareans that are now eligible to receive the vaccine. Well, as most of you know from the news and what we feel here at Beebe and other institutions throughout the state, and I will tell you that the state feels as well, we do not have 200,000 doses of vaccine at this point. The vaccine is coming in a rolling basis, so as more vaccine comes from the federal government to the state of Delaware, Beebe Healthcare receives our allotment of that, and then we push that out to our community and to Sussex County with the amount that we have. So I do want people to realize that Beebe doesn't have a stockpile of vaccine. We actually are pushing out everything that we have to make sure that people are able to get the vaccine that they deserve. Now, when it comes to what you can do to receive the COVID-19 vaccine, there are a few things. The first one is that the state of Delaware actually has a registry system that if you go to their website under the COVID-19 vaccine state of Delaware link, you will see that there's a registry that you can sign up for. This does not automatically guarantee you an immediate spot to get a vaccine, but it puts you on a list. So when vaccine is available and you are eligible, then you will be invited to receive the COVID-19 vaccine in one of the areas that the state of Delaware has identified that is able to provide vaccine. Beebe Healthcare knew that we needed to do something for our community in Sussex County as well. So we have done something similar. If you go to beebehealthcare.org and click on the COVID-19 vaccine link, you will see that there is a vaccine list that you can sign up for as well. And I encourage you to do that. Once we have vaccine available and you are eligible on that list, then you will receive an invitation to schedule an appointment to come to us where we will be able to get you the vaccine. During all of this, we are still trying to, as vaccine comes to us, to get into the communities to make sure that we are providing vaccine to as many people as we can, as much as the vaccine allotment to us allows. So I think that that's really important. So please keep in mind that we are with you. We are working day and night in order to get as much vaccine for all of us. And when I say all of us, I mean all our community, so that everyone at least has the option to receive the COVID-19 vaccine when available. I do get asked, as Dr. Gichuru had alluded to, about side effects from the COVID-19 vaccine. So I do want to talk about some common side effects and give people a little bit of guidance if they have additional questions. So 7 out of 10 people who do receive the vaccine will have a sore arm. They may end up having a little bit of redness around the injection site, or almost feel like there's a little bit of a swelling or a lump there. That is normal, and that is not an uncommon side effect for most vaccines that we do provide. Some people will have some temporary side effects that could be just feeling a little bit more tired than usual, to having a little bit of muscle aches and even some mild chills. Those are all temporary side effects. Those all go away within a day, at most 2 days. It's important to realize that there are a few amount of people that will feel like that they have developed a mild case of the flu, and it's important to realize that as well. That's all temporary and does not last, and it's really important to know that. What I say to people, because that happens with not just the COVID-19 vaccine, but that happens sometimes when people get the flu vaccine or the pneumonia vaccine or a tetanus booster or other vaccines that we give. Sometimes that's just a response from our immune system letting us know that it's ready. It is getting prepared, that in case it does see the infection, that it's ready to go. It's building its defenses to keep you safe. But at the same time, if someone doesn't have those side effects, they feel completely fine after the vaccine, it does not mean that their immune system is not working. So I don't want people to be worried about that either. Before I pass this back over, I do just want to end with just a couple more thoughts for all of us. And so if you can just bear with me for a second. I want everyone to know that here at Beebe Healthcare, that I and Dr. Arias, Dr. Gichuru, and Dr. Tam and all our team are working nonstop to get as much vaccine as possible. We are trying to do this so that everyone has an opportunity to receive the vaccine. And I tell you that we will not rest until we have as much vaccine that we will meet the amount of demand with the amount of supply of vaccine that we can get. So I want you to know that. I also want you to know that we work just as hard to receive vaccine for the second doses as we do for the first doses. So if you get a first dose here, we are working just as hard to secure a second dose for someone as well. Some of this is out of our hands, but I want you to know that we work and we will continue to work just as hard to get that second dose. I know there's a lot of talk about that. As Super Bowl Sunday comes up, I do want everyone to remember that we are still in the middle of a pandemic, and I need people to please follow what we call the 3 W's. Make sure that you are keeping you, your family, your neighbors, and your community safe. So remember the 3 W's, which is wear a mask, wash your hands, and watch your distance. And in this case, if you are around people who are not in your household, please do this safely while you're watching the Super Bowl. To make sure that you have distance and you're doing all the measures and wearing a mask while that may happen. I want you all to be safe, and I want us all to get through this pandemic together. And with that, it's my pleasure to turn this back over to Dr. Tam. Thank you for your time.
Thank you, Dr. Chasanov. Well, I hope you had you were able to get some good information. And, I just want to say I'm so proud of Beebe Healthcare. If you kind of watch today's video, this is where, I've been here now for about almost 11 months. And the vision that I had when I first came to Sussex County and Beebe Healthcare was how to create a health system that really focuses and serves everybody in the community. And so, one of the things that I learned in California, as well as being a member of several national boards focusing on diversity in healthcare, is that a healthcare system best serves its community if it reflects the diversity of the community. And so here we have today, we had Dr. Chasanov, who is a local, comes from here, grew up here, knows this place like the back of his hand. And you got Dr. Arias, who is a board-certified pulmonologist, lung doctor, intensive care unit doctor, taking care of all the COVID patients in the ICU, who's been here for a while and speaks fluent Spanish. And then you have Dr. Roseanne Gichuru, who's recently arrived here, born and raised in Nairobi, Kenya, trained in the United States, and really, once again, reflects the community in terms of the growth of our diversity. And then you have me. Now, I'm only a doctor on TV. I don't really practice anymore. But if you look at the four of us, all of us are doctors, and all of us reflect a different component of really the population that Beebe Healthcare serves here in Sussex County. And that's what we're going to do, because as you know, that is the next generation of care. The next generation of care here at Beebe Healthcare has to reflect the next generation of the patient population here in Sussex County. And that is what we are striving for, because that's the best way we're going to provide you care. So you heard today about one aspect of that care, which is about the COVID-19 vaccine. And you heard from three different doctors about what it means to come from a different culture and talk to family, and what it means to get the vaccine, and what the science is behind the vaccine, and how each of them came to their own understanding of how it's safe, how it works, and how it doesn't create a lot of problems, and how it's so important to our community and to each other and our families to get vaccinated. So as we continue to do this, please remember, we are working very hard at Beebe Healthcare to get vaccines for everybody. I will be the first to tell you, honestly, that there is a shortage of vaccines still here in the United States. Beebe Healthcare is working very hard to get as much vaccine as possible for the people here in Sussex County. So remember, you can go to beebehealthcare.org. You heard that from Dr. Chasanov, and get on our waiting list. When it is your turn, when you're the tier that you're in right now, I think he shared with you, we're in tier 1B, which is the high risk patients over 65, as well as maybe tier 1A if you were a healthcare worker that haven't gotten your vaccine yet. If you're in those groups, get on the list. Go to beebehealthcare.org, click on the secure server, and go ahead and get on the list. Also talk to your doctor, your provider. We work very closely with La Red, La Esperanza. We worked with the First State Community Action Agency this past weekend to make sure that, once again, people who may not have the ability to have easy access to a computer or even be able to drive, or have some language barriers, can go ahead and get on lists to be ready to get vaccinated when the vaccine becomes available to us. Go to the Delaware website. And once again, if you go to our website at beebehealthcare.org, it will show you how to do all those things, because you want to get on as many lists as possible to make sure that, when the opportunity comes up, you will have the opportunity to get the vaccine. But Beebe Healthcare put our list together so that you know that we will not forget about you, and that we will get to you if you hadn't gotten the vaccine and when the vaccine is available here in Sussex County. Just a few more things. That even if you get the vaccine and the vaccine works, remember that the vaccine only prevents you from getting sick from COVID-19. You can still end up with COVID-19 in your nose or in your throat. And so even if you don't get sick, you can still cough and give it to other people. So even though you might get vaccinated, it's so important still for now and for the foreseeable future to make sure that you wear your mask, that you wash your hands, and that you watch your distance. We want to get to the point where everybody is vaccinated, and that there are so many people who are now protected against COVID-19 that we will have a safe way to spend time with our families, to visit our grandchildren or our grandparents or our mothers or fathers and spend time with them, as Dr. Gichuru mentioned when she talked to you about the vaccine. And then don't forget, last thing, is that the hospital and our clinics are safe. We have done everything possible to ensure the highest quality of healthcare and the highest level of safety. That's important because so many people are avoiding the hospital, avoiding the emergency room, avoiding the walk-in care, or even their own doctors because they're concerned about getting COVID-19. Please remember, though, that you need to take care of yourself. We need to make sure that you continue to take care of your high blood pressure, your diabetes, your congestive heart failure, all those other medical problems that you need your medicine for and you need your checkups for. Don't hesitate to come in and be seen because we are safe and we will take care of you in as safe a manner as possible. You know, this month is a couple things. This month is actually the American Heart Month. It's why I'm wearing my red tie. It's an opportunity for all of us to talk about heart disease and stroke and the cultures that are at risk for having higher rates of heart disease or higher rates of stroke or diabetes. And so please make sure that you get yourself checked out this month as we celebrate American Heart Month. It's also the African American History Month in February. And so please, once again, on behalf of Beebe Healthcare, we want to celebrate the African American culture here in Sussex County. And the best way to do that is to communicate with you in a culturally sensitive way to make sure that you know that the vaccine is safe and that you should take it as soon as you can. It's, by the way, also National Women's Physician Day yesterday. Not today, but yesterday was National Women Physicians Day. And you know, Beebe Healthcare is growing our physician pool. Lots more doctors coming here. You saw, for example, Dr. Arias, who's been here for a while. She's a veteran here. And then you saw Dr. Gichuru, who's brand new to our community. We're also bringing in some new breast cancer surgeons. We have a new female urologist, you know, and it's just one more way, not that one's better or one's worse, but understanding the needs of the community, that people feel comfortable when they are taken care of by others, by physicians, by nurses who reflect the diversity that they have, that they represent. And so we're really proud of the physicians, especially the women's physicians that we have here as we celebrated National Women Physicians Day. Lots going on at Beebe Healthcare, but at this time, you know, want to make sure that you know that COVID-19 is beatable. We can beat it. We're going to do this together, but it means that we all need to get vaccinated as soon as there is vaccine available. And when there is, you can trust us here at Beebe Healthcare to have the programs and the clinics and the processes established to take care of you and get you vaccinated. On behalf of everybody here at Beebe Healthcare, thank you so much for tuning in. This will be recorded and, of course, broadcast on social media and other channels. It is being recorded on the 4th of February, Thursday, now at 6 p.m. As information changes, as it does, as new information comes out, we will be here to make sure that you hear straight from us what the medically appropriate, scientifically correct information is to help you take care of your family and yourselves as we continue to work together and fight this pandemic. Thank you very much and have a good night.